My name is Kyra Scobie Hamilton, and this project is on older adults age 65 and above in urban communities. Population of interest is older adults 65 and older in urban communities, representing a growing population due to increased life expectancy and urbanization. According to the U.S. Census Bureau of 2023, 54 million Americans are aged 65 and older, with nearly 80% living in urban areas. This demographic often experiences unique health challenges due to aging, including increased risk of chronic diseases, cognitive decline, and limited access to comprehensive health care services. Urban population is often diverse. Variations in socioeconomic status, ethnicities, and health conditions. Racial and ethnic minorities make up 23% of older population, and nearly 10% live below the poverty line. Urban dwelling older adults often have greater access to healthcare, but may face challenges such as social isolation, environmental pollution, and housing instability. Many individuals in this group rely on Medicare or fixed incomes, which can further complicate healthcare maintenance and disease prevention. Healthcare on the brink of navigating challenges and aging society in the United States. The baby boomer population is the largest cohort in the United States history, making up 73 million members. As this cohort reaches retirement age, this population will increase the 65 and older population from 17% in 2022 to 21% by 2030 and 23% by 2050. One of the main drivers of this increased healthcare demand and utilization among the elderly is high prevalence of multiple chronic conditions. According to the CDC, 88% of older adults have at least one chronic condition, while 60% have at least two. This includes common conditions such as hypertension, dementia, cancer, diabetes, and chronic kidney disease. The demand for healthcare workers is expected to outpace the supply, resulting in a projected deficit of 1.2 million registered nurses and 121,000 physicians by 2030. To the left here is some graphs on how the senior population is growing exponentially. As you can see, every decade, 2022, 2030, and 2050, the population is just getting bigger and bigger. And you can also see how chronic conditions differ based on access to care, as urban communities have lower chronic conditions while people in rural areas have an increase in multiple chronic conditions, with 64% compared to 7% for older adults. Impact of Alzheimer's disease on population of 65 years and up. So Alzheimer's disease significantly impacts older adults. It is the most common form of dementia, leading to progressive cognitive decline, functional dependence, and eventual death. Roughly 6.7 million Americans, which is about 10.9% of the 65 years and older adults, live with Alzheimer's in 2023. Number of older adults with Alzheimer's is expected to double by 2060, reaching 13.8 million. Individuals experience loss of independence, quality of life decline, while caregivers also suffer emotional, physical, and financial strain trying to take care of these individuals. Urban areas may experience higher reported cases due to better diagnostic facilities as well as better access to care, though disparities exist within the care among urban communities. And Alzheimer's accounts for $345 billion healthcare dollars, in the U.S. annually, and projections show that it is rising as the population ages. This graph just shows that dementia is an umbrella term. It's basically for brain diseases, and their symptoms include memory loss, impaired judgment, personality changes, difficulty performing daily tasks. And these are all the different types of dementia that can be caused, but Alzheimer's makes up the most, as it makes up 60 to 70% of dementia cases, with vascular dementia being second. Three levels of prevention and the role of advanced practice nurses. Primary prevention would be prevent the onset of Alzheimer's disease through health promotion. So basically, we want to educate our patients, reducing the risk of cardiovascular health, promote regular exercising, smoking cessation, adhere to a Mediterranean diet, facilitate programs that promote cognitive health, social engagement with the community centers. Secondary prevention, we want to detect Alzheimer's early into the later progression, implement treatment sooner. So we do this by performing cognitive assessments at routine visits, like their primary care visits, to with tools such as the mini mental state exam and Montreal cognitive assessments. Facilitate timely referrals to specialists like the neurologist for comprehensive evaluation and diagnosis. Tertiary prevention would be managing the disease, optimizing function, reducing complications of any kind. The role would be developing individualized plans to enhance safety, reduce risk, such as falls prevention and medication management. Provide support and education for the caregivers and the patient, and coordinate with the interdisciplinary team accordingly. Clinical and community setting activities demonstrating the advanced practice nurse role. In the clinical practice, we conduct those cognitive assessments in the primary care setting for those patients who are 65 and older. We educate the families about possible pharmacological treatments like cholinesterase inhibitors and non-pharmacological methods. Initiate advanced care planning as early as possible while the patient is still with it. In the community setting, we want to organize and facilitate educational workshops focused on brain health, early detection of cognitive decline. Partner with organizations such as the Alzheimer's Association to provide caregiver support groups and community resources. Lead community-based health promotion initiatives such as memory cafes, exercise programs aimed at cognitive preservation. These are just some images from last year's event. This is an annual health fair that's held in Gonzales, Louisiana. I live in Louisiana, and this is the Capital Area Agency of Aging. So basically, it's an advocacy group for elderly people, basically to promote health and wellness in those elderly populations by doing, screenings, blood pressure, hypertension, and they also work with Medicare Part D. Advanced practice nurses activities in the clinical and community settings across prevention levels. So primary prevention, organizing those workshops on lifestyle modifications that promote cognitive health. Secondary would be implementing routines, cognitive screenings, primary care settings, detect early cognitive decline. Tertiary would be leading support groups for patients and caregivers, offering education on the disease progression management strategies. Screening tests, performance, cost, and effectiveness. Early detection of Alzheimer's disease can be facilitated through various screening tools. Common screening tools include the mini mental state examination assess cognitive function, widely used but may have cultural limitations. The Montreal Cognitive Assessment evaluates different cognitive domains sensitive to detecting mild cognitive impairment. Cost and accessibility. These tests are generally low cost and can be administered in a primary care setting during their annual exam, making it accessible and widespread for use. Effectiveness. While effective at indicating cognitive impairment, these tools are not diagnostics and should be followed up by comprehensive evaluations, which can increase costs because there's referrals to neurologists, and then MRIs, brain scan, blood tests, which could all be another barrier, as transportation or cost can be an issue. Potential unintended consequences of the screening. While screening has benefits, potential harm must be considered. May lead to unnecessary anxiety, further invasive testing through false positives. False negatives could provide false reassurance, delaying a diagnosis and intervention. Overdiagnosing, identifying cognitive impairment that may not progress to dementia, leading to unnecessary treatments. It is essential to use validated screening tools and ensure that these positive screenings are followed through with diagnostic testing through brain imaging like PET scans, MRIs, CT scans, cerebrospinal fluid analysis, and necessary blood tests. We want to ultimately detect early, but this can be a very trying time for the patient, so we want to make them as comfortable and as educated for the caregivers and the patient during this time period, as it could be a lot and overwhelming to be diagnosed with this. So, and these are my references.